Good morning, afternoon, evening, or night, wherever you're watching from. Ladies and gentlemen, Mossan Health is here, and we are honored to present to you our health prize submission. 6,600, that is the number of women diagnosed with cervical cancer globally every year. 94% of deaths happen in low-income countries, and this is a disease that, when caught early, is highly preventable. In Africa, HPV has a 24% prevalence, and cervical cancer is the number one cause of cancer death among women on the continent. At home in Senegal, nearly 2,000 women diagnosed every year and 1,300 deaths. Why? Because the barriers are real. High testing costs, screening centers are hours away from rural communities, lack of specialists, waiting lists are long, professionals are scarce. This is not a failure of willpower, this is a failure of access. So, we built a solution aligned with two global goals: SDG 3, good health and well being, and SDG 10, reduced inequalities. Mosaan Health, one mission, not to replace doctors, but to give them a second eye. We have our self sampling kit, a brush a woman can use herself privately. Comfort, general and non invasive. Autonomy, she controls her own health journey. Intimacy, her privacy always respected. Accessibility, from Dhaka to the most remote village. In our cultural context, dignity matters as much as diagnosis. Then, our AI-powered digital microscope, we combine precision, time efficiency results in under 24 hours, portability goes everywhere patients are, low cost, affordable for all, offline works anywhere because of our AI embedded system. The doctor receives the AI's analysis as a second opinion, a safety net. We are not replacing expertise, we are amplifying it. And HPV is just the beginning. Malaria, sickle cell, parasitic infections, any disease with a microscopic signature becomes a new module on our platform. Our primary clients are the Ministry of Health, public deployment at scale, NGOs and international agencies, partners already active in the region, laboratory networks, public and private labs. The revenues come from selling the device, consumable refills, and disease detection modules. Facilities pay per condition they screen for. The more diseases we add, the more value we create. Our total budget is $3,535, around 2 million CFA, covering hardware, AI training, clinical validation for 2 prototypes, user training, and a contingency reserve. Our objective is to save lives. 30% reduction in late-stage diagnosis within 3 years. Strengthen healthcare. Results in under 24 hours help doctors treat faster. Zero access inequality. 70% screening coverage in rural pilot zones. The WHO's own targets. Restore women's agency, removing barriers of cost, distance, and discomfort, turning the fear of diagnosis into a simple, accessible act of prevention. For our next steps, we want prototype optimization, refining the kit based on user feedback, market validation, engaging ministries and health partners across West Africa, local dataset and app, training our AI on local data and launching a patient follow-up app. We are Khadija Tuja, Mechanical Engineering, designed the self-sampling brush. Ajamari Toure and Alisa Madeleine Fatimayum, Computer Science, built and trained the AI model. Mossan, a Serer word meaning beauty, the beauty of a life saved, built by African women for African communities. We are Mossan Health. Thank you.